Summer heat means summer sweat, and for some, it's a little extra discomfort. You can ask Adele if you don't believe me. Here to help you stay itch-free, Dr. Richard Chafu, the itchy, itchy, itchy. It's not comfortable to be
Not
itchy.
Not at all, no, definitely.
Singer Adele just shared that she suffers from something called Jock itch. If anybody's not familiar of what that is, what is Jock itch?
So Jock itch essentially is a fungal infection, very common, Charlie, in areas where the skin rubs against itself, because those are areas that tend to be moist, dark, very warm, and they're great breeding grounds for fungus infection. So it's essentially an opportunistic infection, if you will, which occurs in athletes very commonly. That's the term jock itch, but it can occur like in performers and in times where there's a lot of sweating. And the problem is surfaces like what we call the intertriginous zones, the areas between the groin and, the thigh area, or in the axilla or under the breast areas where the skin surfaces are opposing against each other and they're rubbing, and that tends to collect moisture and warmth, and that's a breeding ground for the development of fungus infections.
So when someone like Adele admits and says, hey, this is what happens, I would want to assume it's from Spanx, it's from the undergarments that many performers wear.
It is, exactly. That's one of the common things, because you're right. What happens with that, it traps some moisture, and then again there's that chafing that goes on, that rubbing and increasing temperature, and then that's that breeding ground for this fungus infection.
Does it spread fast?
So it can spread rather quickly in those areas, and typically what people will notice is there's an itching, sometimes there's a burning, and the rash can have various colors, so it's not necessarily one color, but it tends to be, sometimes it will be red and raised along the edges. There may be some scaling that occurs as well. So there are many ways it can present, but it can be treated pretty easily once it's diagnosed by your physician.
When you say treated pretty easily, what is the treatment for jock itch?
The treatment, because it's a fungal infection, it would be antifungal treatments, and those are typically topical agents like maybe an ointment, might be a cream, might be a powder, but it takes time. It may take a few weeks of continuous treatment to have the rash go away. And most importantly, we have to change our habits. So if we're using this slimwear, Spanx or something else like that, you want to really give that area rest. So you don't want to do it more than, say, 8 hours at a time and not sleep in it, and maybe have a day of rest where you're not using it. It just takes time for you to get over that rash.
I was going to ask you, there are things that you can do to prevent that. I would hope that people don't sleep in the undergarments like that, somewhere overnight, but giving it a break and really keeping the area clean and keeping the clothes clean.
Yeah, and realizing there is treatment, but like in anything we've talked about before, especially in the summer months where it's warmer, we're sweating more, and get in to see your physician when that rash is early on. Don't wait, don't try some home remedies, because you might be using the wrong treatment. Sometimes people will say, well, I'm just going to use a steroid cream. You don't want a steroid cream on a fungal infection because it'll make it worse. So you're better off to get in to see your doctor, to have he or she make the diagnosis and get the treatment started early so you get better.
You see your doctor. If something's itching, go see your doctor.
Go see your doctor.
Dr. Chafu, always good to see you. Thank you.
Good to see you too, sure.
All right, 7:49. Let's get you over to Chrissy. We're itching for some warm, good summer weather.